Yeah, so from a reimbursement perspective, this is the bugaboo, right? That it comes down to. There's no direct reimbursement. I mean, there's some CPT codes around 3D visualization, 3D rendering, but not the actual 3D printing. And so that is a path that we're on and we're pursuing and we're actively involved in. But there's several challenges to it. First of all, it's a long time to get that. I mean, medical device companies, when they're trying to get reimbursement, they launch patient studies with hundreds, if not thousands of patients. It takes multiple years of follow-up. And often those are in very specific indications, right? Whereas I think we've all heard all the applications here are so varied that to demonstrate value across all these use cases, and reimbursements can be very different for a small model like this aneurysm case, right? The cost base can be very different versus this much more complex model. So what we see really is in the long term, we're gonna push for reimbursement. We're gonna pursue that path to the full as we can. But in the short term, what we think we need to do is demonstrate the economic value is there, and that the economic incentives between the hospital, the payer, and the patient are aligned. That makes 3D printing critical for these more complex, challenging procedures. And so the drivers of that economic value that we see are multiple. The first one is reducing operating room time, right? So a lot of the cases that you'll see, case reports on surgical planning, they'll be reported that by the physician's estimate, it saved half an hour, 2 hours of procedure time. In recent studies of operating room time in the U.S., priced that at $60 a minute, right? So if you can save an hour of time in the OR by having a better planned approach, a more optimized approach, that's real dollars behind it. Saving 5 minutes isn't going to do anything for you, but you can start monetizing it when you get into those larger chunks. The second thing is avoiding complications, right? So if you're able to take a procedure that has a 10% risk of a complication and reduce it to 5%, you can never avoid it completely, but if you can reduce the complication rate, there's real money there. Again, recent studies of complications show that just having a single complication in a surgery can increase the cost by $20,000 to $30,000. Right? So if you think about the value of avoiding a complication, and certainly if it's a catastrophic complication, it can be $100,000. So there's a lot of value there also. And then you also have reducing hospital stay. So the cost of a stay of a single day in a hospital inpatient is $2,000 to $3,000, depending on your public, your private, your type of institution. So if you're able to, with a more minimally invasive approach, treat the patient in a way that they'll heal better, heal faster, and get out of the hospital, you can reduce the number of days in the hospital, and that's real savings to the hospital within the patient DRG coverage. The last value that we see is really kind of an overall framework shift in medical care delivery. Historically, healthcare has been a fee-for-service approach, right? So you go to your doctor, you have a procedure done, the doctor, the hospital is reimbursed because they performed that procedure. We're going to be shifting now to, it doesn't matter if you were healed, it doesn't matter if you live longer, it doesn't matter if you avoided complications. We're shifting to a value-based reimbursement world, right? And a lot of that has been put into the Affordable Care Act and really started with the Affordable Care Act. There's now reimbursement penalties associated with hospitals that have high readmission rates, that have low patient satisfaction, that have all these other metrics associated. So every hospital is now looking for ways to improve on those metrics, to avoid readmissions, to improve patient satisfaction. And one way we strongly believe you can do that is with the 3D printing models that can optimize the procedure, engage the patient in understanding their procedure, get better informed consent. All of those things will be ways that you can reduce those the reimbursement penalties. So there's there's no direct reimbursement, but there's a lot of drivers of economic value, and it's about communicating that to your hospital administration to to demonstrate to them where the printer can save money and improve outcomes.
Can I add something on the length of the procedures that you just mentioned? Especially if you do a minimally invasive on pediatric, you want to minimize the radiation to the minimum possible. These are population that actually, if you radiate and increase the chance of cancer, may have like really bad repercussions on the later life. If you have someone that is maybe in the 70s, you're not as worried, but at least for this pediatric population, radiation dose because of these minimally invasive procedures should be a huge concern. And if you can minimize that, can reduce it by doing some training or treatment planning before, with such a phantom will be like a huge advantage or benefit.